Hello, I'm Dr. Jonathan Weisman. I'm a dentist in Fremont, California. And today I'd like to talk to you about the best ways to take care of your teeth. What brought this on was when I was in dental school, I was shocked to find out all the information that I should have known in order to understand and really take care of my teeth. Since that time, I've developed a way to show patients how to do it, and I hope you'll find it interesting. First, let's talk a little bit about anatomy, because I think that will really help you understand what's going on. If you look here, you'll see there's a tooth in bone. The outside of the bone has this kind of thick plate, and the inside of the bone has something called bone marrow. So the root of the tooth is suspended to the bone with thousands and thousands of little fibers. And if you'll notice, these fibers go from root to bone, but not from bone to enamel. So around everybody's tooth, there's something called the pocket, where the saliva with bacteria will also be underneath the gum. What we're doing here is this instrument is called a probe, and each color of this probe is 3 millimeters, and we measure the depth. In this case, I would say this is just over 3 millimeters in pocket depth reading. Generally 2 to 3, that's pretty good. Now you're going to see the healthy side and the unhealthy side. With the healthy side, we still have a nice plate of bone going all the way around the top here, and the tissue's pink and healthy. On this side, you'll see a couple things. First of all, that healthy plate of bone has gone away. The tissue is kind of a little more swollen and red. It's similar to something you might find on your own hand. For example, if you scratch your hand, it might get puffy and red around there. If you have a sore on your hand, and you touch it and it's tender and it bleeds, you know what to do. In fact, don't touch it. And you'll put a bandage over it and it will heal all by itself. With your gums, it's exactly the opposite. So why is this tissue irritated? The reason it's irritated is that the bacteria that accumulate under your gums here create an acid called lactic acid. This acid is not an extreme acid. You won't taste it, you won't feel it, but it's just acidic enough that it dissolves the lining of this tissue here. So if you brush this tissue, likely it's going to bleed. And it might even be a little tender. And most people have the gut reaction of, well, better not brush it. But exactly the opposite is true. If you leave it alone, the bacteria accumulate more, creating a bigger density of the acid, more damage. So the best thing you can do with bleeding gums is spend a little more time in that area. I call it attack the bleeding gums, and then they'll in time get better. Won't heal in a day. So the second day you brush them, they're still going to bleed. But after about 2 weeks, it'll be less and less and probably gone. So if my hand represents the tooth and my thumb are the gum line, this is the pocket area. We're all taught as young kids, hey, go brush your teeth, right? And so people brush the teeth. But the bacteria down here get neglected. So you'll never get under the gums to get that cleaned out. So it's really a manipulation of the gums to kind of force stuff out. Yes, sure, brushing the teeth, but also massaging the gums, okay? The other thing I want to cover a little bit is the difference between plaque and tartar. Very few people know the difference between plaque and tartar, so here they are. Plaque, that's the bacteria. They're small microorganisms, you can't see them, but they grow in colonies, and they hold to the teeth with these little thin fibers. They're very easy to brush off, probably has the consistency of wet bread. Tartar, on the other hand, calcium, magnesium, other minerals that bond to each other with kind of like a magnetism, and they form stone. If you think of walking in a cave where there's water dripping from the ceiling, that stalactite is a mineral stone, and that's very similar to what tartar is. And that has to be scraped off by a dentist, and some people form a lot of tartar and some people don't. It's merely a function of your body's capacity to put minerals into the saliva or not. So no matter what technique you're using, if you build tartar every time, that's just the way it is. It starts building the moment you leave your dentist's office. All right, let's talk about some of the tools in our arsenal, what we're going to need. So I like an electric toothbrush more than a manual toothbrush because the electric toothbrush can oscillate in a frequency and give more power than you could possibly do manually. So here's some three different brands. The Braun Oral-B, well-known company. This one operates with kind of a rotation like this and also a tapping. So the rotation, excellent in scrubbing the teeth, and the tapping, really wonderful to help move the bacteria up and out of the gum line. These next two are just oscillating back and forth toothbrushes, both very good. They make a lot of different brands, and even each brand has a lot of different models these days. You want to get one that's very powerful, and it's really worth spending some money on it. I've also noticed that some of these have features that maybe they Bluetooth to your phone and give you some feedback and things like this. I don't know that I personally feel the need to invest money in those extra features. If you have a toothbrush that has a regular mode and then a sensitive mode, to me, I feel like, well, yes, you're spending money for a nice, strong toothbrush. Why then make it sensitive? So go for the power and then and the placement as I show you how to do it. So here we have a model of teeth and gums, and we've talked about the pocket. So that means that there are bacteria living underneath the gums. And again, clearly, brushing up here is not going to get that pocket. You want to be here. Being down here does nothing. So I call this brushing the teeth at the gum line. This is the gums at the tooth line. And especially for all adults, this is what you want to do. Here's how to use an electric toothbrush. So many people, I find, brush with it. And that's not really the intent. The intent is let it do the work. So I'm going to turn it on and I'm going to place it on the gums, and it's going to start vibrating and really shake the gums up. I'm going to move slowly around the arch, and then if I start in the back and I get to the front, I'll overlap and come around this way, and that avoids missing any teeth. I find that people who brush the sides here and then the front sometimes miss the corners. I see that quite often. Now, on the inside, you can't go parallel to the tooth. You have to dip it. So get down like this, and you'll go onto the gum line, let it do its vibration. When you get to the front, you're really going straight up and down. You're not going to try to go sideways. And then you come back around this way, and that's how you do that. Now, flossing is very misunderstood. If you can imagine if there was chocolate sauce all over this tooth, here. A lot of people floss using a sawing action, which would really only clean one thin line on the tooth. You want to use the floss like a scraper. If you have that floss and you're holding it tight and pull it, it will bend slightly and you can scrape this area. If you look at a tooth, you might find that there's a convexity this way and then there's a concavity maybe in between the teeth. So when the floss bends, it will do a fine job over the convexity, but when it gets down to the concavities, there's no way that the floss can actually get to where that concavity is. There are areas in the teeth that the toothbrush and floss just can't get to. So I would like to introduce the concept of a water irrigator. If you've ever seen somebody clean their driveway or sidewalk with a power washer, that water coming in with force and then the splash going in every direction really does a great job of cleaning things in nooks and crannies that can't be cleaned otherwise. Okay, the water pick company came up with a really clever idea of how to show the effectiveness of water irrigation. There's an ear of corn with something sticky in there. Manual toothbrushing doesn't get it completely clean, nor does electric toothbrush. In just a moment, you'll see what water can do. The water splashing, I call it water explosions. Look how the water splashes, goes every direction and can clean everything out of there. Let's pause for a second. Okay, what I'd like you to notice is a couple things on this one. If you can see, the tip of that water irrigator is not touching the corn. That water's coming out in segments. It comes out in splashes and needs to go away before the next one comes in. So you don't want to have this touching your teeth. You want it back away from the teeth a little bit. And the other thing I want you to notice is this particular tip is clear. It's called the classic tip. Some of the other tips have various different bristle configurations and or a little rubber tip coming off the front of it. I like this one the best. It has the biggest diameter opening and it allows for the biggest water splash. Okay, this is a water irrigator that I can really recommend with full confidence. It's the one I use. It's called the Aquarius by Waterpik. I get mine on Amazon. It's the cheapest place to get them. Let me go over some of the functions. On the top, there's a little rotating thing spinning and helps you go around the arches. There's an ejector button where you can have different colored ones, and several people in the family can use the same one. On and off button. There's one that has a floss massage, 2 different functions. And the way this works is it'll have a steady pulse, or with the floss, a kind of intermittence. I just leave it on that's the massage one. I just leave it on the floss. Now, here's very important. The power levels go from 2 to 10. And at 2, I would say worthless. Don't even bother there. Go at least 8 and really try to get to 10 if you can. Also very important, when you fill this up, you're going to use pretty much the full tank. So you fill this up with water. You're definitely going to learn quickly to use warm water, because cold or hot, your teeth won't like. Personally, I like to put a splash of peroxide or an alcohol-containing mouthwash in there. I just feel like it helps keep the lines clean and nice. So you're gonna fill that up with some warm water, and then when you turn it on, it's going to start shooting water out. This also has an auxiliary on-off here, and that's handy so that you can turn it on and off midstream. When you're using this, the water needs to hit perpendicularly to the tooth. If the water hits the tooth like this, the splash is going to go in every direction, including down under the gums. It's that splash under the gums that's going to rinse out the bacteria under here, and you're going to go just above the gum line on your teeth. It's going to hit in the front, and then in between, and that's the way it's going to work. So again, you're going to pull it back off the tooth as long as it's a little bit. It can be out here, it can be here. Doesn't really matter. And it's going to start out making these intermittent bursts, and you're just going to make a straight line just above the gum line on the outside, and then on the inside, same thing, just hit the tooth perpendicularly. If you angle it down into the gums, it might not be that comfortable. Here's something I always find interesting, and I pay attention to it sometimes. If I've just eaten a poppy seed bagel, let's say, and I brush and floss my teeth, maybe I'll take a cup of water and really swish vigorously, and then I go to use a water irrigator, what I'll see is little poppy seeds coming out. And boy, they can't be good for you if they stay in there long term. And the last thing I really want to tell you, because I've heard too many times when I forget to tell people this, if you look in a mirror to see your positioning, that water is going to just splash all over your mirror. So the way to do it is you'll grab this device, you'll put your face down low in the sink, and you'll just kind of sense how that's hitting your teeth, and you'll have to develop your technique that way. I wish you all the best, healthy gums to everybody, and thank you for watching this.